Thank you, Mr. Speaker. Members, I'll be brief. I do just want to ask a couple things. And first, I appreciate Representative Bucy so much. I know where his heart is on this. I just don't agree with him on some of the facts, but also don't agree with him that this is a good idea. First, I want to talk just about Medicaid spending in the state of Texas. 20 years ago, we were spending $19 billion on Medicaid. It was 16% of our budget. Now we are spending $73.5 billion. It is now 23% of our budget. Y'all know we're budget night. We have a balanced budget in this state, so that means 100% of that cost increase has pushed out every single other item that you care about. Education is now harder to finance because of the growth of Medicaid in this state. Roads, water, every single thing. I know this is important. Medicaid does some great things, okay? But we have really expanded dramatically the number of people covered in Medicaid.
Does the gentleman yield?
Does the gentleman yield?
I'd like to finish and then I'd be happy to.
Not at this time.
Thank you, ma'am. So I think it's important to understand that we have gone from 2.5 million people 20 years ago to over 4.5 million people now, and that's even after the dip. That is a tremendous increase, not just in the number as the Texas population has grown, but that is also a tremendous increase in the number of people already covered by Medicaid, not to mention the cost. So in a balanced budget state, there is no question that means it pushes out everything else that you want to do in this House. I want to just mention a couple quotes. If you want the best reasons not to expand Medicaid, all you have to look at is some of the, and I apologize for making it partisan, it's a little bit partisan, but some Democrat governors. I'm going to use two quotes from Andrew Cuomo when he was governor of New York, because I believe he is spot on in what he says. He said, if we don't control Medicaid costs, there will be no money for education, no money for property tax relief, no money for economic development, no money for infrastructure. It threatens everything we do. It's Governor Cuomo. Second thing he said, the issue of Medicaid is not that Medicaid is a bad program. It is not that I want to reduce the benefits. It's just that we are spending too much money on a program that has no built-in cost management, period. I want to keep working with members of this House to make sure that we drive the cost of health care down, and I want to get coverage for people. Medicaid expansion is absolutely, in my opinion, bad policy for a bunch more reasons with that, and I'll be happy to answer any questions.
Ms. Rose, for what purpose?
Does the gentleman yield?
Does the gentleman yield for questions?
I would love to yield to my
Gentleman
colleague,
yields.
to my classmate.
Representative Frank, I hear that you're talking about the high cost of Medicaid, but do you know how many individuals, do you know that Texas has the most uninsured individuals in the country?
Yes, there's about 5 million uninsured. There are 2 million of those uninsured that qualify for ACA, qualify for the Affordable Care Act, and choose not to take it despite the subsidies. There's about 800,000 of those that make over 4 times poverty and choose not to buy an insurance product, but clearly have the money to do it. There's a number that are here illegally, and then there are, so yes, there are 5 million people, but the Medicaid, and just so we all know, the Medicaid expansion population covers 1.2 million people, but according to HHSC statistics, only about 800,000 of those will take Medicaid if we expand. And while that 800,000 is important, I think it's more important that we focus on the 30 million people, because we can do things in this House that affect all 30 million people.
Okay, but I guess what my concern of what you're asking is you're talking about Medicaid as if, because you acknowledge education and you were saying all of the things that it was taking money from.
Yes, ma'am.
But who does Medicaid serve?
It depends. It serves various purposes, mostly children and lower income.
Well, did you not know that seniors are has the highest utilization of the Medicaid program?
Well, I thought most seniors were on Medicare.
No, but you do have,
And then special needs adults also on Medicaid. Those are actually the high volume users and honestly, one of the things that has happened in some states is when they have expanded, it has made it harder to cover those who actually need it. When you put more able-bodied people on a program, it makes it harder for those who are truly in need to use that same program.
Well, Representative Frank, you know, I know you know this like the back of your hand. You have chaired the committee, and I know that you know seniors utilize Medicaid as well, because some of their Medicare cannot cover all of they cover their nursing home fees.
Oh, okay,
Am I
I'm
correct?
sorry. I'm sorry, on the Medicaid, on the
Right.
on the nursing home. Yeah, and
But it's still but that's still a senior, right?
that's true, but the Medicaid expansion that I believe is in Representative Bucy's amendment only covers the medical part of it. Texas is actually far ahead of the nation, not of the nation, but of the requirements in what we do for nursing homes. We actually cover a lot higher number than the federal government requires in nursing homes, so I think that is something that you'd be proud of us on.
Well, I did not say I was not. I'm very proud of it, but that's the point that we're trying to make to you. But the uses of by us expanding Medicaid, more people will be able to have services. But I don't like the fact that you all are making it seem like this is able-bodied. These are the most vulnerable populations in Texas. Nobody is sitting around trying to be on Medicaid.
But
I don't think there's one person you can say, you want to be on Medicaid? Yeah, I want to be sick. Because if you're on Medicaid, you're sick, right?
Not necessarily. There's people on Medicaid that have never gone to the doctor that we still pay. We still pay every month for every Medicaid patient, whether they go or not. That's the way our program works.
But in order to be eligible for Medicaid, it has to go through a doctor. The doctor has to approve it, right?
I think that may be correct.
You know it's correct. Thank you, Mr. Speaker.
I don't know everything. I really don't. Thank you very much. Members, I encourage you to vote against this amendment.
Mr. Speaker,